and of course all those proteins clog up in the glomerular filters, and that condition is called rhabdomyolysis or myolysis, which will cause some renal failure. So we treat that by stopping the Zocor and giving a ton of IV fluids. And depending on the extent of muscle damage, might even need some rehabilitation, physical therapy. Okay, number 21, niacin, vitamin B3, is useful for the treatment of hypertriglyceridemia. However, it can result in extreme flushing approximately 1 to 2 hours after taking. Which medication should be prescribed to prevent this, and when should it be taken? So, two questions. We're going to prescribe a medicine to help prevent the red man syndrome, which is what I'm talking about, and when do we take it? Metoprolol 20 minutes before the niacin, no. Aspirin 1 hour before niacin, that's aspirin 325. This says aspirin 81 30 minutes before. So here we've got the right dose on number 2, but the wrong time, and the wrong dose on number 3, but the right time. So number 4 is 325 milligram aspirin 30 minutes before niacin. That's just the way it is. And I've started quite a few people on niacin before, and I always prescribe an aspirin with it, but I've never had anybody report red man syndrome. So it's one of those things that is a more common side effect, but it's not guaranteed to happen. But still, always prescribe aspirin with it. Okay, number 22, a patient with diabetes mellitus has had difficulty with his glucose lately. You check a hemoglobin A1C and find that it is greater than 10%, so definitely diabetic. Wait, no, we already know they're diabetics, so it's not well controlled. You also check a lipid panel and see that the triglycerides are abnormally elevated and cholesterol is on the high end of normal. Which of the following medications would be most appropriate to first prescribe? So I've talked about this a bit. 22, I had 2 people ask me about this question. So here are the choices. Lopid, which is gemfibrozil. The next is over-the-counter fish oil daily supplement. The next is simvastatin. The next is Januvia. Okay, so what we're talking about here, and in the case of diabetes mellitus, you will see in many patients when it's very poorly controlled, uh, diabetes drives up triglycerides. Okay, not necessarily. I mean, you're going to have high cholesterol with high triglycerides, but you will have abnormally. You'll see patients with abnormally high triglycerides from poorly managed diabetes. And ultimately, if you have a patient, this is just sideline information. If you have a patient who has pancreatitis and they don't have a gallbladder and they're not alcoholic and they are diabetic, look at their triglycerides. That will easily cause it. Okay, so here's the deal. Januvia is for the treatment of hyperglycemia, so well, that would work on the hyperglycemia, but not the triglycerides. Okay, simvastatin is definitely a consideration, but certainly geared more towards cholesterol and lipoproteins rather than triglycerides. And then over-the-counter fish oil daily supplement, we know that's wrong because I've said it, and you can even watch a TV commercial and figure this out. Um, you would have to take an entire bottle of over-the-counter fish oil today to get even close to what is actually beneficial for you, and then you would never ever be able to land another date or kiss from your husband, wife, or whatever, because you would smell like a gigantic fish in your gastrointestinal system in perpetuity. So the answer is gemfibrozil because it specifically treats triglycerides. So this question is a little complex because we're talking about the high, poorly managed diabetes, but the focus is triglycerides. So gemfibrozil treats the high triglycerides, and of course, in a real life situation, the real answer is, well, we're going to do that, and then we're going to see what else we need to do about getting the glucose down, because if we don't drive the glucose down, well, lipid's not going to do much. But triglycerides, the answer here is a fibrate. Okay, the 23, I don't see anybody asking about that. The NCEP guidelines recommend that all adults over the age of 20 years be screened at least every 5 years using fasting blood samples to determine trends in lipid profiles and whether or not to start medical therapy. That answer is true. It's on page 131 under step 1 in the Spotlight on Hyperlipidemia Guidelines. Okay, question 24. I've got that one on the list. When prescribing loop diuretics such as Lasix or furosemide for either hypertension or heart failure, you should always monitor which of the following regularly. Okay, so the answers are albumin, which is a protein, alkaline phosphatase, which tells you about liver, creatinine, which tells you about kidney function, and then magnesium, which is another electrolyte. So I think somebody selected magnesium, and the reason that is incorrect is because although loop diuretics do wreak havoc with your electrolytes, this is more of a critical thinking question. Of all of these things, which is the most important? And that's creatinine, because loop diuretics will cause renal failure if you're not careful. Very important to watch out for that. So the answer is creatinine, because we're checking renal function, make sure we're not causing renal failure. And really, if we're talking about electrolytes, the first electrolyte we're going to see a deficiency in is going to be potassium. Okay. All right. 25. This looks like the last question. Geriatric patients often have multiple comorbidities, including hypertension, coronary artery disease, and renal failure. In such cases, which advice would you give a patient when starting a new anti-hypertension drug? Okay. Question or answer 1 says be sure to drink plenty of water. That could be legitimate depending on the medication. Number 4 is check your blood pressure at least twice daily. As long as the pressure is fine, it doesn't matter how quickly you go from lying position to standing position. That's wrong. Even if you're not on antihypertensive and you're over the age of 80, you should never get up fast. I can barely do it myself. Number 3 is take these medications with plenty of grapefruit juice. And of course, we all know, even from undergraduate school, that grapefruit juice doesn't go well with any kind of medicine, it seems like. So the right answer is when you change from a lying to, and this is, we're talking to the patient, and we're giving you this new medication, and this is my advice. When you change from a lying/sitting position to standing, be careful to take time between each position change to allow your blood pressure to adjust. What we're talking about is an orthostatic, a postural hypotension. Of course, they'll fall, have a broken hip, you'll have all kinds of new problems. So, all right, those are all the questions on quiz 2. If you have any further questions, if this didn't specifically answer what you were looking for, please email me again. I hope this cleared it all up. I think I'm going to give credit for at least 2 of these. And all right, cool deal. So the next quiz is coming up sometime soon. Good luck in your studies. You'll probably start seeing some new lectures from me from now on, because the rest of the content's kind of mixed up from last semester. So, all right. Now I feel like I was looking at the test instead of the screen, so I feel like I was up in your face. It will cause you nightmares. All right, everybody. Chill out. Have a good weekend.